Hi everyone, welcome back to my channel. If you're new here, welcome, and I hope you enjoy the videos here. If you're a returning subscriber, welcome back, and thank you so much for watching all my videos. Thank you for all the questions, the comments. Everything means a whole lot to me, so thank you. So today I'm going to talk about the differences between a pharmacist who works in hospital and a pharmacist who works in community. Before I go into the video, I just want to put a little disclaimer out there. I haven't worked full-time as a community pharmacist. All I have done is locum shifts, and locum shifts are short shifts that you do usually on the weekends, or sometimes could be weekdays, but the ones I did were weekends where the usual or regular pharmacist is not around, and then I was just like a temporary person during the weekend. So it wasn't my full-time job. All my full-time jobs have always been in hospital, and that's where I currently work. I'm saying this because my knowledge of being a community pharmacist in its entirety will be slightly limited compared to obviously a pharmacist working in hospital, which is where I've worked for a couple of years now. Okay, so but I'll try my very best to do a nice comparison. So I'm going to start with a pre-reg pharmacist in community and a pre-reg pharmacist in hospital. And of course, as I said, I didn't do my pre-reg in community either, but I do have friends who did theirs in community. And I actually spent like 2 weeks in a community pharmacy. So it's part of the pre-reg process. So during the pre-reg placement, the whole 1 year thing, 2 weeks or could be a little bit more, you'd do something called a cross sector placement, where you could work in another sector of pharmacy. So if you're working in hospital, you would have a couple of weeks in community, and if you're working in community, you would go to hospital. And I don't know how it's done in industry, and yeah, basically you just go to another sector and work for a couple of weeks. So yeah, so why don't we just get right into the video? I don't want to waffle on. So let's start with a pre-reg in community. What do they usually do? So with a pre-reg in community pharmacy, I feel like in the beginning, you're learning the very basics. So you're learning how to dispense, which you would have learned a little bit during OSPAP, but it might be a different system that will be used in the community pharmacy where you might be doing your pre-reg. So you're going to learn how to use the dispensing system. You're going to learn how to label. You're going to know or learn how they store their medications, how it's picked up. Is it alphabetically or is it done in a coded way? So it's done in different ways in different community pharmacies. You're going to do that. You're also going to learn about some of the minor ailments that people would usually come in for. They would say, oh, I have, and I think I have an eye infection, those little things. You're going to learn how to give advice. You're going to learn, obviously, how to contact the GP for prescription queries. You're going to be able to hand out medications to people. And there's just so much stuff to do. And I've heard it is very hard work working as a pre-reg in community, because when you think of a community pharmacy, there are not a lot of members of staff. So an extra member of staff will almost work as a full-time worker. You would work full-time, but I mean, like, you would work really hard, basically, is what I'm trying to say. So yes, but you will learn a whole lot in terms of running the pharmacy on its own. And I feel like people who do their pre-reg in community, once they pass their exam and they're qualified pharmacists, they could almost boldly and confidently go in the next day to be the pharmacist of that community pharmacy, because they would have already been somehow acting in that role as they progress in their pre-reg placement. And I'm sure this is true when people who have done their pre-reg in community, they will probably agree with that. So you have a lot more confidence. You're also learning other skills like managerial skills, admin skills. By watching, you're learning how to, speak to other people. And it's a whole lot of skills that you're learning. And if in the future you want to run your own community pharmacy, maybe back home or, here at some point, it would be, I don't want to say easier, but it's a little bit easier to get into that role. So yeah, so that's basically the knowledge of what I know pre-reg community pharmacists do. I do know many people say it's stressful, as I've mentioned, but I feel like the rewards at the end is worth it. Now let's go to hospital pharmacy. I've spoken a whole lot about pre-reg and hospital. I'll link all the videos down below, but I'm just going to give a brief overview, just as I have done for community pharmacy. So with a hospital pre-reg, you are going to be working initially alongside a pharmacy technician. That will just be in the beginning part because you're going to be completing some tasks. As I said in my previous video, things like completing drug histories, you might learn how to do medicine reconciliations, you would learn how to check patients' own medications and, make amendments and adjustment in terms of like if things are expired, throwing it away, and obviously with the patient's permission, those kind of things. You're also obviously going to learn how to label and dispense. And I have to say, labeling and dispensing in a community pharmacy and in hospital, they're very different, but we'll go into all that. So it's completely different. You're going to learn how to do all of that in hospital, and the difference is that you're not working only in the dispensary. In fact, it's just going to be a small part of where you work. You will be working on the ward, so I feel like it's a little bit wider, the things that you would do and the things you would learn. So you're going to be working alongside, as I said, a pharmacy technician, and then within a very short time you'll be moving on to working with the pharmacist. If you work hard, you'll be able to ease into the role of a pharmacist when you pass the exam. So yeah, working with a pharmacist, you're doing screening, you're doing interventions, you're doing counseling, you're learning how to speak with the other members of the MDT, you're making notes inside medical notes or entries into the medical notes, you're interpreting lab results and things like that. So it's quite a wide range of things that you're doing. The major difference I would say would be around clinical knowledge. In community, and especially as a pre-reg, you might not have the opportunity to learn a lot about the clinical aspects of the medication, because that's just the way the whole community pharmacy is designed. People bring in a prescription, you might not have enough time to go through it, and you don't have access to so much information about that patient. So you're just almost going to believe and be happy that the GP has recommended the right medication, but doesn't mean that you will not be able to challenge one or two things here and there. You can't see blood results, you can't see anything, so you are not able to make that holistic decision about if a prescription is appropriate for a patient. You're just going to obviously trust whoever has prescribed it and check that do the normal legal checks and the doses, and make sure what it's fine, and you're hoping it should be fine. So that's the main thing I would say. The access to information and clinical knowledge is limited in community pharmacy, but in hospital pharmacy you have access to so much. You have access to blood results, medical notes, clinical letters. There's so much information you can do. In hospital, you will get a wide array of diseases, as you would expect, and you would learn a lot about them because you'll be seeing patients that have these diseases, and they kind of stick a little bit more as opposed to when you're reading about it. So in community, you might see the people that have the diseases, but you might not know that they have it, and you might just concentrate on giving out the medication. Another thing I think could be a major difference is the timing. I find in community pharmacy they are very, 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 very busy, and because of the number of staffing that they have, even the biggest community pharmacy would not have anywhere near as much members of staff as even the tiniest hospital. And that's a big difference, because when you have limited people working in a certain area, it just means that there's increased pressure. And of course, patients do give you pressure as well. They would come in and they're waiting, you're just trying to do things a little bit quicker. So in community, when you're doing community pharmacy, you're going to be doing a whole lot of working a little bit more under pressure, but at the same time that's also improving your skills, in the sense that you can work under pressure really easily. Over time you'd learn that skill, but in hospital there are a lot of people, and you're never really under a lot of pressure, time pressure, let me just put it like that, except when you're doing discharges. But generally there isn't that. You have to do things quick, as you would find in community pharmacy. Okay, now let's look at those managerial skills I was talking about. When you become a pharmacist working in community, you're going to be in charge of so much stuff. You're going to be managing people, so dispensing assistants and technicians, the store girl or boy, or all the pharmacy assistants. You're going to be managing these people, and these are really good skills to have, because you might not get that opportunity in hospital, especially when you're just newly qualified. But as a newly qualified community pharmacy, it's very easy to get those skills because you would have built them up over during your pre-reg or your pre-reg period. So yes, you will be able to do that. You would also learn how to manage a whole community pharmacy, and believe me, it's not easy. You're going to be in charge of ordering stuff. They have a lot of administration stuff that they will be doing, and this is in addition to being a pharmacist, so doing all those clinical checks that you can do. So that's one very good quality. So in hospital, you will not really, especially as a junior pharmacist, there's like very minimal chances that you're going to be managing anyone, to be honest. Like, you will still be managed, and yeah, you probably would not. Maybe pre-regis, but you wouldn't directly be managing them. You can, show them things and all that, but you're still, in the teaching stage. Another thing I wanted to talk about was the confidence. I personally feel as a community pharmacist, when you pass the exam, it's very easy to feel confident, as I said earlier, coming in the next day as a pharmacist, because I feel like you've been doing it already, so you're not really scared of anything as such. But in hospital, all through the pre-reg, you're always managed by someone. Like, they would never really leave you alone, which obviously they're not meant to, because you're no pharmacist, but someone's always countersigning everything you do. So it can actually be mind-blowing knowing maybe on Friday you were a pre-reg, Monday you're now a pharmacist, have to sign things, make decisions, and it is very it can be scary, but yeah, eventually you'll be able to do it. So, as I already said, in terms of like team, in community pharmacy there are closer team members because they're smaller and you guys have a tighter knit. But in hospitals, especially if you work in a big hospital, it's very hard to like be close to everyone. Like in my hospital, we're over 300 pharmacy staff, and I'm talking about technicians, pharmacists, pharmacy assistants, workers, people that work in the stores and things like that. So yes, it could be, you're not going to be close to everyone as such. That's something to bear in mind. Another thing is obviously the kinds of medications that you will come across in hospital. There's so many medications that are hospital only, and those ones require a lot of monitoring and things like that. So that's kind of things you would learn more in hospital. And in community, they won't even dispense those kind of medications, so you wouldn't come across them. You wouldn't know anything or a lot about these medicines unless you do your own research. Another thing I was going to talk about is in hospital, like in many hospitals, in fact almost all the hospitals I've worked in, and I've worked in about 4 hospitals here in the UK, and they all have robots. So robots are in the dispensary, so basically you just click on the medication that you want to dispense and it comes out of the robots, and you just stick the label on it. So that really makes life a whole lot easier. And in community pharmacy, as far as I know, I don't think they have robots. They might have robots in maybe other centers where they do things like nomads or blister parks, but in terms of specific community pharmacies, they hardly would ever have that. Okay, so I think that's pretty much it. I don't want this video to be too long, but what the final part is obviously in the salaries. So as a community pharmacist pre-reg, you usually would get anything from £18,000 to about £20,000. I think some pre-regis in community, in some big community pharmacies might get a little bit more than 20k, but it's usually that amount. But in hospital, as a pre-reg, you would be on something called band 5. So in NHS, especially if you work in the hospital, it's under the NHS, and most hospitals are, the salaries are based on something called Agenda for Change, which is AFC, and is always amended every time. And there you're banded. So there's specific bands, and there are some spine points in those banding. It's slightly complicated, but basically, if you're a pre-reg in hospital, you'll be going in at band 5. And as far as I know, last time I checked, band 5 starts from 23,000. If you're in London, it will be a little bit more because they pay high cost allowance. So you might be getting anywhere from £23,000 to maybe 26,000, 27,000, and that's as a pre-reg. But when you qualify as a pharmacist, when you're in community, your salary would go up. It is as much, or let me say the starting salary is usually from 35,000 and above. I hope this is correct. If it's incorrect, I'll put the right figure on the screen, but as far as I know, and it can go up to 40k, sometimes 41, 42, is quite significant. Whereas in hospital, as a newly registered pharmacist, if you're in London, it might be a bit higher, but it would usually start from around £30,000 and go upwards. Yeah, I'll double check as well the figures because they always change these things. But for a band 6 pharmacist, so when you've qualified as a pharmacist in hospital, you will become something called a band 6, and I think that's the salary around £30,000 and above, and depends on where you are. If you're in London, it will be a bit higher. Now with hospital, you will be doing on-call services, and you would work weekends and you do late nights and things like that, and those things are extra money. So even though you're just only getting £30,000, if you do on-call and weekends and all that, it shoots the salary up a whole lot more. So you will probably be getting almost equal to what a community pharmacist will be getting. So that's pretty much it. I really hope you enjoyed this video. So I hope you enjoyed this video. If you liked it, give it a like, give it a thumbs up, and I'll see you in my next video. Bye bye.